Hello, I'm Dr. Sean McCorkle at Summer Creek Animal Clinic, and today I wanted to talk to you about dog allergies. And my assistant Judy is going to ask some questions, and I will do my best to answer them to help you learn more about itchy dogs.
All right, so Dr. McCorkle, how common are allergies in dogs?
Extremely common, especially where we are in Fort Worth, Texas. We see allergies year round, and it is definitely the top three, potentially the number one thing that we see in our patients.
Okay, and what are some common dog allergies?
Yeah, so the way that I like to break this down, and these are really big categories, are more, especially when we're talking about skin allergies, which is most commonly what we see. We have an environmental allergy category that we think of. So that's going to be various pollens and things like that humans would typically be allergic to as well. It's just in dogs, most commonly, their immune system is responding with skin issues versus sinus issues. None of this is across the board the same in every situation, but that's most commonly what we see, and that's environmental allergies. Then the second category would be flea allergies. We make that its own category because fleas are such a big deal in Texas, or at least in the way we think about allergies. Technically, that's in the environment, but flea allergies are super common. And one really helpful thing to think about is if you own a dog, if your dog is itching along the back half of its body, kind of where the tail meets the back, kind of that area of the body, if that's the primary issue of itching, it's almost certain that there is some level of flea saliva allergy. So the good news about that is that can be managed quite well with the various really good preventions that we have. The third category that we think about is food allergies, or allergies to a specific protein. So those are the big three categories that I like to break down. With food allergies particularly, again, most commonly we see that manifest itself with skin issues, but also and oftentimes these dogs will also have concurrent GI issues, so intermittent vomiting or diarrhea, chronic diarrhea. And so when we have a pet that's got that plus chronic skin issues, food allergy raises a little bit higher on the list.
Okay. And then how do allergies impact the health and well-being of my dog?
Yeah, this is huge. I think honestly, more than anything else, except maybe periodontal disease, I think skin allergies affect our pets' quality of life more than anything else. And that's just because it's such a common problem and so many dogs struggle with it chronically. And it's like being just consistently itchy. That's why they lick their paws, bite their feet, scratch their ears. If your pet's doing that consistently, it's because they're uncomfortable, and that's their way of showing us by doing those things. So it has a dramatic impact on their quality of life, especially when you end up on the more moderate to severe end of the spectrum of struggling with skin allergies, either consistently through a particular season, or honestly, a lot of dogs year round, it's a struggle.
Okay. And what are some signs and symptoms of allergies in dogs?
Yeah, so I try to break this down in a few different ways. So one big thing we see in dogs is ear infections. So if your dogs if they're scratching at their ears, or if they're shaking their head a lot, or if you lift the ear flap and you see redness or gunk down in the ear or around the ear canal, if there's more discharge in the ear, that means there's more inflammation, and oftentimes an ear infection, which is the secondary problem, oftentimes from the underlying allergy that's driving that inflammation, allowing for the infection to set up. So ear problems, red ears, discharge, smelly ears. And then on the skin itself, outside of the ears, we oftentimes will see red bumps, either raised or flush with the skin, little circular crusts called epidermal collarettes, or thickened skin, oftentimes under the underside of the belly, or on the underside of the feet is a really common area for there to be thickened skin. All of those things are signs of secondary skin infection. The infection in the skin, this is critical to understand, is rarely the primary issue. The bacteria and yeast that overgrow on the skin are already on the dog's skin, but in a healthy skin barrier, they're not able to colonize and cause problems. But when you add allergies, which cause inflammation in the skin, that allows for overgrowth of bacteria and sometimes yeast that cause these changes in the skin that make the itching worse and cause additional skin problems on top of the underlying allergy.
Okay. And then can I diagnose my dog's allergies at home?
The answer is no. You can, oftentimes people can get some grasp of what might be causing it based on the dog's lifestyle and certain times of the year that they itch. So if your dog itches every September or August or September, and then it's fine the rest of the year, most people can infer from that, okay, there's probably some sort of seasonal allergy. But even myself as a veterinary professional can't look at your dog and say with certainty that this is the underlying issue. Allergies are not that simple. Now, flea allergies are a little bit different because of the way they present. We can be 99% certain in a lot of cases that this is flea allergies, or flea allergies are at least a part of it. But apart from that, there has to be a methodical approach to determining what the underlying allergies are.
Okay. And then how will a veterinarian diagnose allergies in my dog?
Yeah, so that's a great next question. So we've already kind of hit on the flea side. And just as another quick note on the fleas, most of the time when I diagnose flea allergies, this is really important to understand as a pet owner. Most of the time, there is not a single flea that I can find on that pet. That's because fleas spend over 85% of their time in the environment. They just jump on the pet to feed, lay eggs, and then they're gone. So if you've got a relatively mild infestation in the environment, you may never see a single flea on your pets. But if they are allergic to that flea saliva, when that flea jumps on and bites them, their immune system overreacts to that and causes inflammation and itching that typically presents on that back half of the body. So just because you don't see fleas on your pet does not mean you don't have a flea issue. That's super important to understand. The only way you can be confident that you don't have a flea issue is if all your dogs and cats in the house or in the environment are on really good year-round flea prevention. And again, I'm speaking from Texas. The other two big categories of allergies, trying to identify what type of allergy your dog might be struggling with. We take a lot of information based on the history, what's been happening over the years with this pet and how frequent are the problems, as well as the type of presentation, where is the itching primarily, and we can, at least from that information, have an idea of what may be more likely, environmental or food, or to even complicate things further, about 20% of dogs are going to have a combination of both. And then based on that information, we can determine which route to go. Now, generally speaking, the thing that needs to be done is the first step is all the pets need to be on really good flea prevention. That helps us to control that category. Then we focus in on a really good therapeutic prescription food trial. It's really important that we don't just go start changing our pets' foods from one brand to the next, because that's not going to tell you if we have a food allergy. It's just going to potentially expose them to more proteins that make it more difficult to parse through later. There's cross-contamination issues with over-the-counter diets that are just not part of the equation when they're making those foods. And so prescription foods, without going into all the details, help us to hone in on if there is a protein allergy. And part of that equation is really tight quality control from a cross-contamination perspective when those foods are being made. So an 8 to 12 week food trial where the dog gets absolutely nothing else in their mouth besides this prescription food, helps us to determine in some of these cases if there is a food allergy. And there's a little bit more that goes into that, but that's kind of the nuts and bolts of it. Then from there, once we've either ruled out food allergies or we're pretty confident it's not food allergies, the only way to adequately diagnose environmental allergies and determine what pollens and things in the environment your pet may be allergic to is through allergy testing. There are a variety of different ways to do that, including some blood testing, but that is generally not thought of as the best way to do it because the results are variable. The gold standard is definitely still intradermal skin testing. And to do that appropriately and to get the most concrete information about what your pet is allergic to, that requires referral to the board certified veterinary dermatologists to get that information. Now, it's not just about figuring out what they're allergic to. If they're allergic to St. Augustine pollen or grass, then that doesn't really do a whole lot because you can't keep them away from that. You may be able to keep them out of the grass, but stuff is still in the air. So the point of doing the allergy testing is so that we can determine what they're allergic to and create a serum to give your pet chronically for the rest of its life to support its immune system to fight the allergies. That is the only direct way to treat environmental allergies. It's not a cure, but it helps the immune system directly fight the allergy.
Okay. And then how are dog allergies treated using anti-inflammatory therapy?
Yeah, so historically with skin allergies, we have in veterinary medicine leaned very heavily on steroids. And steroids are great because they provide really potent anti-inflammatory properties and they reduce itching in most cases very quickly and effectively. The downside is that steroids have all kinds of other side effects in the body. So we don't use steroids, or at least I personally don't use steroids, and our clinic doesn't use them except in very specific circumstances because the risk factor is much higher than with some of the newer medications. So when we're talking about anti-itch medications, which aren't necessarily anti-inflammatories, but that are blocking the itch, which is what most people are talking about, we have new products that are really effective with much lower side effects and risk of complications. So for example, Apoquil was the first product that came out that is really effective. There are some potential side effects, but they're minimal and can be mitigated in most cases. And then even newer than that, Cytopoint, which virtually has no side effects because it's technically an immunotherapy. So unless they have an allergic reaction to the injection, which is extremely rare, it's going to be so focused in the body that it only blocks the itch. And so things that we can do in medicine that are only targeting exactly what we want to do, that's definitely going to be the future of veterinary medicine. And we're already seeing that in how we manage allergy cases and particularly itching in dogs.
Okay. And then how is shampoo therapy used for dogs' allergies?
Yeah, I am a big fan and proponent of topical therapy when we're talking about allergies, because oftentimes these pets, particularly dogs, it's a chronic struggle. And so we really need to think broadly about how we're managing and treating these cases. It's not just about here's your medication or here's your steroids and it fixes the problem short term, but then there's no plan to manage things moving forward. Shampoos, and in addition to that, other topical therapies like medicated mousses, I think are really, really helpful because they allow the pet owner, especially when the skin is healthy, to be doing things that are trying to keep that skin barrier as healthy as possible. So I like to use medicated shampoos, mousses, sometimes sprays on a regular, consistent basis for a lot of these chronically allergic pets that allow us to get better management at home. If you have any questions regarding any of this, we would love to help you and work through this with you. You can reach us at Summer Creek Animal Clinic at 817-523-1139. And our website, where we have more information about dog allergies, is summercreekvet.com.